You expect more context when it comes to the COVID-19 vaccine, and we are joined right now by Dr. Diedre Gifford with the State Department of Public Health.
Dr. Gifford, thanks for being with us.
You're welcome. Thanks for having me.
So, we see the federal government recommending these booster shots. It's one thing to recommend it. It's another thing to implement it. That's where you come in. What is that going to look like for Connecticut residents actually getting that booster shot in their arms?
Well, the first thing I want to say is that for those residents of Connecticut who still haven't received their first vaccine series, that we're obviously strongly encouraging people to go ahead and get vaccinated. There are hundreds of available locations around the state, walk-in appointments, and we really encourage everyone who hasn't yet had their first set of vaccines to get vaccinated. For the boosters, we're waiting on FDA and CDC guidance. There wasn't a lot of detail released today, but we do understand that starting sometime in late September, about 8 months after your original vaccine, it will be recommended to have a third dose as a booster.
What do you think the supply will be in Connecticut for that booster?
We don't anticipate any challenges with vaccine supply once the time comes. The production of all of the vaccines has been on schedule. There is an abundant, we're fortunate, very fortunate in the United States to have an abundant supply of vaccine. And it won't be all Connecticut residents who become eligible for the third dose in the same month. It'll be rolled out over a course of months starting in the fall. So we won't anticipate any problems having enough vaccine for that third dose.
As you know, we've been using numbers, metrics with this COVID-19 fight to have the governor make decisions when it comes to vaccinations, when it comes to masks, opening things, closing things. Schools starting back up in a couple weeks. Masks will be in schools till the end of September. Have you guys discussed what type of metric it will take in order there to be no masks in schools whatsoever?
Well, I would say it's not one measure that we've been looking at, and that's been the governor's strategy throughout the pandemic. There are lots of different pieces of information that contribute to the decisions that he's made to manage the pandemic. He looks at public health first and always has done. I think with vaccinations, with masks in schools in the fall, it will depend on the direction of community transmission. Right now, we have 5 of our counties that are considered to be high transmission by CDC. It will depend on what percentage of teachers and students and staff are vaccinated. And it will depend on what we see in that first month of school in terms of the ability for kids to stay in class and do in-person learning. So I think all of those things will contribute to the decision.
All right, Dr. Gifford, thank you so much for your time. We appreciate it.
You're very welcome.
All right.